You guys know I'm not a big microneedling fan. I'm not a big fan of microneedling. One treatment that I definitely would not recommend is microneedling. RF microneedling, I'm not a huge fan of because I know people are going to ask about microneedling. Microneedling isn't really going to help you much. Microneedling, I'm not a huge microneedling fan. A lot of you guys have asked me about microneedling, and I get questions on microneedling all the time. That is the one treatment that I would not recommend. Radiofrequency microneedling, which I'm actually not a huge fan of. So I'm not a big fan of microneedling. You may have heard me say in my previous videos that I'm not a big fan of microneedling, but the reasons may surprise you. I've avoided this topic because my opinion on this particular procedure may be very controversial in the world of aesthetics, but it's time to talk about it. I'm Dr. Stephanie Kappel, a board-certified, double fellowship trained cosmetic dermatologist, and I'm here to provide a source of truth and honest information in an industry saturated with misinformation and clickbait education. So what does microneedling do? What are the benefits that people are looking for? One of the benefits is collagen synthesis, collagen remodeling, and scar remodeling and revision. And that can pertain to any type of scar. Acne scars, surgical scars, or even just aging and a loss of collagen and elasticity that's associated with the aging process. It's also thought to resurface the skin, smooth texture, tighten skin with stimulation of collagen that helps smooth textured or laxed, wrinkled skin, and to treat hyperpigmentation. This is what it is proposed or thought to be known to do. However, with my experience of people having complications from microneedling, I would not choose microneedling to be used as a therapy to treat melasma, chloasma, brown spots, sun damage, or hyperpigmentation. In fact, it can actually worsen hyperpigmentation. And I see it all the time from people coming to see me in my office to utilize lasers to help treat the pigmentation that has been generated as a result from a microneedling treatment done at other offices. Would it be my first choice for skin tightening or for acne scar resurfacing or for hyperpigmentation? It would not be, and I'll get into it later as to why not. Okay, you guys, I'm here to pick up my son and his friend from surfing because it's almost time for dinner. I'm just trying to multitask as a working mom who's trying to vlog for you guys and educate, because I love making these videos for you, and that's why I do it. So let's talk about microneedling. You have two main forms of microneedling. You have at-home devices and in-office devices. The in-office devices can have radio frequency associated with them, and there's various different forms, and it all has to do with the type of radio frequency, whether the microneedles are coated or plated with certain substances and materials that can make the arc of radio frequency go to different depths in the skin, and that has to do with the depth of the needles, the length of the needles, of the actual microneedles. And so you can change the depth of the tissue plane that you're affecting, and with the parameter of dissipation of heat, which is energy in the form of radio frequency, if the device has radio frequency, that can all be adjusted with settings. The settings aren't too pliable and versatile, but there are some settings that you can use. Now, the at-home devices, whether it's a derma pen or a dermal roller, sometimes estheticians in certain states are allowed to use microneedling devices, especially like the dermal pen or dermal roller. Dermal pens are used for drug penetration and increased active absorption into the skin, because once you poke holes in the skin, your barrier is disrupted and you can have passage through of molecules that are greater than 10 kilodaltons. So at-home devices, just think of them in two strengths. You have at-home devices, which are on a roller or dermal pen, and there's other forms of at-home devices. They vary with the length of the needle. I'm not sure if there's any FDA-approved RF microneedling devices to be used at home. That could be dangerous. I doubt the FDA would approve that because it can also cause atrophy and atrophic scarring and like pox-like scarring if it's done the wrong way. So I don't think that there are many FDA-approved microneedling at-home devices that use radio frequency, because people can get themselves into trouble, and we have to protect patients from hurting themselves. The in-office microneedling devices like Vivace, Profound, Infini, there's Morpheus 8, there's like so many of them. They all vary depending on the depth of penetration and also with or without radio frequency. And if they do have radio frequency, it could be monopolar, bipolar. The arc of radio frequency, like between the two pins or microneedles, if it goes through that, there's different depths of penetration and dissipation of heat, which stimulates fibroblasts, the collagen producing cells in our skin, to produce collagen. Which it does produce collagen, but there really haven't been any well-powered studies showing the statistical significance of the amount of collagen that is produced by microneedling with any real sound clinical data, like in our peer-reviewed literature in journals. But microneedling is used for scar remodeling, fine lines, wrinkles, and collagen stimulation. But we're going to get into it like the truth and the good, the bad, and the ugly of microneedling. I gotta go pick up my grum. One more wave, Mom, one more wave. So when comparing microneedling to thermage and other energy-based devices and laser resurfacing, it doesn't hold a candle to it. And I know some people in the comments section are gonna say, well, I Googled and I found this study, or I found this study on PubMed that shows that microneedling can stimulate collagen and can tighten skin. You have to remember that a lot of those studies, we have a whole didactic series of lectures in residency in medical school where we learn how to dissect statistically significant studies and well-powered studies, and to be able to decipher between studies that were performed by third parties in academic centers versus studies that were produced by third parties that were hired by the manufacturing company of the microneedling device can be very corrupt and can be very misleading. So when you're citing a study, or you say, Dr. Capel, I found this microneedling study, a clinical randomized controlled study or a clinical trial that shows that microneedling can tighten skin, most likely that study, if you look into the fine print and you look at the methods section of the abstract, it will be funded by the company that produces the microneedling device, because otherwise you wouldn't be able to find it on a simple Google search. Peer-reviewed academic literature and papers and statistically sound studies that are non-biased and performed just for the generation of collecting data so that academic centers know which products to use over others. These are unbiased, non-sponsored, they're not paid for by the companies who manufacture, and they're very, very clean. So unless you're showing me a study like that, just don't be fooled by marketing, because even these research studies and clinical trials are all part of marketing in the big picture. Skin tightening. Can microneedling be used to tighten the skin? The data shows no. There's no clinical statistically significant study showing that it can tighten skin. In fact, tightening skin is usually achieved by energy-based devices and lasers. I believe that anecdotal data can show that microneedling may use to tighten skin, but it wouldn't be my mainstay of therapy for a skin tightening device like microcoring with Ellacor or with laser resurfacing with like a fully ablative CO2 or fractionated device. And I feel that this could be misleading because a lot of people will have microneedling done for skin tightening effects, and in fact it can actually sometimes cause more skin laxity and thinning of the skin based on atrophic scarring that can occur from the microneedling process. We gotta go, buddy. I'm sorry. My dinner's ready. You should just ask me about microneedling, because it doesn't make sense why you'd poke holes in the skin to make the skin look better, right? But sometimes trauma to the skin makes the skin look better. Does that make sense? I love you. Love you. 5 a.m. I'm gonna go eat my toner. I'm using these products. You guys all ask me about how my skin has changed over the last 4 years. It's engineering these MDR products. If you do microneedling, you definitely need this NMF barrier repair. If you want microneedling results without having to go through microneedling, you use the RxR retinol and you use the vitamin CFK, and that's what I'm putting on my face right now. Because these skincare products with the vehicle delivery systems and active ingredients in it, you honestly don't need to do in-office procedures if you want to go that route. 47 years old, 5 in the morning, about to meet my trainer. I'm so tired. I'm 46. I always like advance my age by 1 year, but I'm 46. I'll be 47 in June. Neck tight. You guys are always coming into the office wanting treatments for your neck. Instead of investing in a package of microneedling for your neck to address laxity, Neck Tight has our topical argireline in it, which is like Botox in a bottle. And it has active ingredients specifically for the neck and décolleté to keep it nice and smooth and tight. So instead of wasting money on a package of microneedling, it's a medispas that's gonna make things possibly worse and make the laxity worse. Just invest in a medical grade. It doesn't even have to be this one. Invest in a medical grade skincare product that's engineered for the neck and décolleté. And that skin epidermis and dermis are thinner. They need different vehicle delivery systems, and you need somebody who understands how to formulate and how to scientifically improve the pharmacokinetics of vehicle delivery systems, not just like a celebrity or influencer who launches a white labeled skincare line. You need engineering and technology, innovation, and someone who spent years looking under the microscope at skin, understanding how these products work. Okay, my brain's not even working. I literally just had to throw this in here because I'm putting all these products on. Let's talk about why I'm not a fan of microneedling. It's morning and my kids haven't gotten up, but I'm gonna make them breakfast before going to the gym. Okay, why I'm not a fan of microneedling. In my office, I always see the complications that happen to people who have microneedling done at other offices. And the problem is that sometimes people think it's a benign treatment, meaning like very low low risk, and it's not. It can cause hyperpigmentation, it can cause loss of subcutaneous tissues and atrophy or thinning of the skin, it can cause acne, it can cause infection, it can cause scar-like acne, scar-like pox scars and boxcar scars and eye scars. It can make your skin look more dilated with respect to the pores because of atrophic scarring that can sometimes happen with microneedling. But the biggest problem I think I see as a provider, having to reverse other people's complications, is hyperpigmentation. For example, the other week a little girl came in and she was doing like preventative microneedling at home with a at-home device, and instead of stimulating collagen to smooth out some tiny fine lines she had under her eyes, I mean, she was in her 20s still, so she hardly had anything, and she's trying to be proactive, and now she has these hyperpigmented patches underneath her eyes that we now have to use all kinds of lasers to try to like reverse. So here she is trying to do a good thing and use microneedling to help prevent fine lines and wrinkles from forming under her eyes, and now she has to come in once a month and get different laser combinations to kind of like fade the hyperpigmentation that she induced by using microneedling. I have another patient who had beautiful clear skin and was in her early 30s, and she went in for some microneedling just to stimulate collagen and be preventative, and she had some early signs of some fine lines and wrinkles, and now she has like, she almost looks like she has acne scars, like poxmark scars that are going to be with her forever unless we use Fraxel and CO2 and laser resurfacing to try to smooth those out. So it's not that I'm a hater on microneedling. In my office I have every device known to man on the market, sometimes ones that aren't even available, FDA approved yet, going through clinical trials. And the reason why I don't have microneedling in my office is because it doesn't perform as well as lasers and energy-based devices. But back in 2014-15, when microneedling first launched, I was the first to have a microneedling device. I was super stoked, super excited. There was so much hype in the industry. We were so excited to have this new available treatment for our patients. And then we had different microneedling devices in our office. I trained at a big facility, a big laser institute, where we're like the epicenter of clinical trials, and we're using these microneedling devices for like, we had high hopes, and we were all disappointed. We were like, it doesn't do anything compared to a laser or a CO2 or a Fraxel or even a Clear and Brilliant for that matter. Actually, Clear and Brilliant wasn't even available yet. So this shows you how old school I am. I've been doing this for 20 years. So microneedling has a lot of money behind it, a lot of marketing, and you'll see it on every street corner. But for true dermatologists who are laser experts, it doesn't hold a candle to laser, and half the time we're trying to reverse complications that happen from people who have microneedling, and that in and of itself becomes more expensive than the microneedling package that someone pays for to have microneedling, for prevention or just smooth out fine lines and wrinkles or smooth out acne scars. And it ends up costing the patient more money in the long run because they're spending all this money on lasers trying to reverse the complications from microneedling. So just keep that in mind. And that's why I'm not a fan of microneedling. I was all about it when it first launched back several years ago, and was just disappointed when I saw that it didn't perform. And then fast forward 5 years, now it's in like every medispas and everybody's talking about microneedling. I'm just like, no. Not only is it underwhelming, why do you think they offer packages? You have to buy 3 packages because you won't come back otherwise if you just have one treatment. Like, this doesn't work. And also, the true meaning of like looking at a before and after is looking at the results maybe 3 months later and seeing the effects and the changes it has on the skin. Most people who post before and afters or who think microneedling is great are either people who are very young and maybe microneedling will make a difference, but for some more mature skin, it's not going to do much. And I feel like it's false hopes and over-promised, under-delivered results. And immediately after, you'll have some swelling because you'll have inflammation. So your fine lines, your wrinkles, your acne scars, everything will look better temporarily. But fast forward 3 months and see what your skin is looking like. After a Fraxel, after a laser, 3 months later, your skin's looking bomb, and it keeps getting better. And over a lifetime doing that, your skin just looks amazing. I have women in their 60s and 70s who have baby skin because they've been doing lasers. Microneedling, you'll look good 24 hours later, maybe 48 hours later, but 1 month later, you'll probably be back to where you were before, and 3 months later, you'll definitely be back to your baseline, what you were like before you even spent the money and the time and energy having microneedling. And 9 times out of 10, you'll probably look even worse. So that's why I'm not a fan of microneedling. Now I got to get my kids breakfast. It's a gray, gloomy morning. If you guys have any options for making yummy eggs for kids in the morning, I'll take it because my kids love eggs, but I'm kind of getting bored of how I make them. I love that you guys don't mind me doing these vlog style videos because every morning I get up, I make my kids breakfast, I pack lunches, and usually they like hot lunches, so I'm making something hot like dumplings or stir-fried rice or chicken in the morning, putting it in their little Yeti thermoses. So at lunch at school, they have like a warm, hot, cooked meal from mom. And I make them breakfast, and then I get them off to school. Then I work out. And then I go to the office and I see my beauties, my patients, and I do what I love, and that's practicing dermatology. But it's hard to balance everything. But the fact that you guys don't hate me for doing vlog style videos is actually amazing, because it allows me to do both. Because if I had to set aside time to do the videos while in a busy clinic and just raising kids, I would never get around to making these videos for you guys. So thank you for loving me for who I am, and I think we have an amazing community here on YouTube. I'm gonna see if I can pull up some old videos of me, like when I was a baby, the early 2000s, doing microneedling, because I'll show you. I want you guys to see actual footage of me doing the microneedling device 10 years ago. I was one of the first to be able to play with a microneedling device. So when people are like, have you heard of microneedling? It's this new technology. I'm like, I've been using that for 10 years. When I wasn't impressed then, and I'm still not impressed now. But what I am impressed with is the amount of marketing and hype on social media, and Kardashians backing it up. There's one company in particular that has over $3 million dedicated just for marketing. So of course they're going to be popping up on every street corner. Of course you're going to see microneedling everywhere. The marketing and the funding and the money behind these big companies who promote and manufacture these devices, and the marketing that they have, the money that they have to spend on marketing is like astronomical, more than a laser, more than you're going to see, more than Fraxel's going to have. But the key is that Fraxel and lasers require a higher level of skill and a higher level of training to use these tools and devices, that you're not going to see them as abundantly as you see a microneedling device. A microneedling device is like an everyday car. Anyone could just jump in a car and drive a car. But if you have like a high performance race car or like a jet airplane, you need a pilot. You need a race car driver who knows how to operate those. You need to find the right driver, and those people are fewer and far between. But when you find someone who can use these lasers and devices, and you're not settling for a dime a dozen microneedling that anyone can do, then your results are next level. And my patients can attest to it. If you're a patient of mine and you want to make a comment in the comment section, there's nothing that can come close to the elegance or the outcomes of a laser or an energy-based device. Are you out of bed yet? Breakfast ready. Did I hear your little voice? Hey, good morning. Sweet girl. Bye, Bubba. Bye, Bubba. Bye, bud. You have a good day? You have a good day? Sleep? You're tired. Such a good boy. It's a banana with honey on it. Beautiful day. And I do this every morning. Okay, so for my breakfast, my Orgain drink and my coffee with collagen peptides in it. Do the potential risks of microneedling outweigh the benefits? And in my opinion, the answer is no. Complications, hyperpigmentation, loss of elasticity, and worsening of skin laxity, acne-like scarring, pock scarring, atrophic scarring, infection, all of these complications that can happen with microneedling do not outweigh the potential benefit, because you end up spending more money reversing the complications from microneedling than you spent on microneedling in the first place. You're here with me going to my trainer. Let's talk about medispas ulterior motives. And not to be negative, but I want to protect you guys, because aesthetics is getting so out of control right now. If you've seen my previous videos on talking about unlicensed providers, counterfeit procedures, counterfeit Botox, counterfeit filler, counterfeit deoxycholic acid or Kybella, people with fake credentialing, there's no such thing as board certified in aesthetics. Watch my video talking about that if you missed it, to protect yourselves from having treatments done by people who are not qualified or trained to do so. So the field of aesthetics and that whole space is just so contaminated with fraud and with misrepresentation, with patient complications, and with increased risk for patients, that this kind of is a segue into it. Microneedling is a treatment that you're going to find at a lot of medispas. You won't find it in too many doctor's offices unless it's a doctor who has a bunch of extenders doing the procedure. So plastic surgeons, other aesthetic providers who may not be derm trained by residency training, but maybe crossed over into aesthetics to make a little extra money after being in a certain field, dealing with insurance. Microneedling is one of those treatments that you're going to find at medispas because it's easy to find providers to perform that procedure. Microneedling is not rocket science, you guys. You don't have to worry about the settings. You don't have to worry about the physics behind the mechanisms of action of the device. Yeah, there's a couple settings settings that you can choose from. You can choose the depth. You can choose if you have radio frequency or not. But it's not like you're changing like the spot size or the wavelength or the fluence or the pulse width or the hertz or the anything. It's like lasers, you have to really customize and understand the physics behind lasers and how they work in order to pick the correct settings to customize the treatment for each individual patient. Microneedling is such an easy procedure that you can find anyone to just perform that procedure. So you're going to find them abundantly in every medispa. I think in Newport Beach and Orange County here, I mean, you can't even walk through a medical building without seeing 20 medispas. So you're going to find microneedling all over, but does that mean it's the best? No, it's the easiest to do. It's basic. It's the easiest thing to do, so you're going to find it in the most abundance. Lasers, you're not going to find everywhere because you have to find a laser surgeon who understands how to work these devices, and that is a lot harder to find. Okay, you have to come see my trainer Casey with me. Casey, I'm sorry I'm late. I'm vlogging. You ready to go? Okay guys, just finished my workout. I'm now going to head to the office, wash my face and do my full skincare routine and start seeing patients. To continue on with this microneedling video, when talking about microneedling as a procedure and talking about medispas in general, you always have to question why a provider is recommending a certain procedure. Is it because they are only trained to do that procedure? Could they even provide a laser service if they wanted to? Do they have a laser provider who knows how to use the machine? Or are they using microneedling because it's the easiest device to operate in a clinic? Just because microneedling is more readily available doesn't mean it's better. It's probably more readily available because it doesn't require a lot of skill to find someone to operate a microneedling device as opposed to a laser surgeon. It's hard to find someone who is well versed in lasers and understands laser settings, wavelengths, pulse width, fluence, spot size, different combination of wavelengths. I mean, laser physics takes a lot of training and education in learning how to use lasers versus microneedling. I mean, my 9-year-old daughter could do microneedling. There's an on-off switch. There's maybe 3 different settings, and the settings aren't rocket science or physics-based. It's not like you're talking about pulse width, fluence, or wavelength or coherent light or anything like that. It's like, do you want the small, medium, or large needles? How deep do you want to go? And is there radio frequency or not? So I guess what I'm saying is, if there's a medispa that's pushing microneedling on you, it's not necessarily the best treatment. It's the more readily available treatment. Just like all these cars, you're going to find way more everyday cars than you will finding a high-performance race car. But that doesn't mean the everyday car is better than the race car. It's just harder to find a race car with a race car driver who can drive it. Question packages too. In my office, if you're a patient of mine, I never do packages. I want somebody to be so happy with the results from a laser or a procedure that they come back for more. And sometimes we'll switch it up. Sometimes we'll do one laser and then the next time we'll do a different type of laser, or we'll do a different energy-based device or combination therapy. It's just like, when people rope you into a package or they make you have a membership, they're trying to retain you as a patient, probably because the results aren't that good or the results aren't that impressive. Because I don't know how many patients I have come in my office and they're like, Dr. Capel, I've already had one microneedling and it didn't work, but I paid for a package of 8 and I have this membership at this medispa, so I have to go back, but it's not really doing anything. What should I do? And it's like, people are obligated to go back to the medispa because they're already roped in and they've already paid for the treatment. But to go back and get the treatments because you've already paid for them, but they're not working, it's just like a bad situation to be in. So question medispas who offer packages and memberships, because they're offering those for a reason. You should come back because you liked the results, not because you've already paid for treatments. So I always think that that's a red flag if people are offering packages or memberships. Patients should come back because they're happy with the result, not because they're roped into a membership or they bought a package. Sometimes it's not always shady. Sometimes there's just a difference in education levels, and maybe when someone doesn't know, they don't know. So they don't know what they're missing out on. So say somebody is just getting into aesthetics and they have some rep from a microneedling company that really sells them on a device and it sounds great, and then they buy this device, so then they have to up the marketing and bring in the revenue by using this device on patients. So at my office, my laser office in Newport, if there's a device in my office, it's there for a reason. Any device in my office has to have reproducible, superior outcomes. And if it's not in my office, it didn't make the cut. Versus someone who's maybe less knowledgeable in aesthetics, say that you're a pediatrician who doesn't want to deal with insurance or practice pediatrics anymore, and you want to open a medispa because it's very lucrative and you can make a lot of money. And you're like, well, gosh, I don't really know anything about aesthetics. What should I buy for my medispa? And you have some microneedling company rep come in and sell you the world saying this microneedling device is awesome. So then this doctor who owns a med spa buys this device and now they have to like sell it to their patients and the marketing is just out of control. Someone who really understands aesthetics and who's been through like laser procedural dermatology training, like a fellowship, a rep comes through my office, I put them through the ringer. I know what marketing schemes they use, and that's why I don't have a microneedling device in my office. If microneedling was amazing, I would have one. I'd probably be the first to have one, but I have lasers because they're just so much better. And if you're going to invest money in microneedling, think about the complications that microneedling can cause, because you're going to spend a lot more money reversing those complications, or spend your money on like a really amazing medical grade skincare product that's going to give you more than a microneedling procedure will give you. For those of you who've had great microneedling results, most of you guys are probably younger. For more mature patients, I see patients of all ages, but mainly my patients are probably like in their 30s, 40s, 50s, and 60s. Usually 40 and above will not respond as well to microneedling because you just need a little bit more elegance and you need more strength in your devices and your procedures. In the comment section, if you go through my previous videos, you'll see people saying usually negative things about microneedling, but the ones that do have positive things to say are usually younger. Now let's talk business. Let's talk about overhead. Let's talk about owning a private practice or a medispa. So lasers are very expensive. They're like high performing race cars. I mean, they're very expensive. As a laser specialist, I only buy lasers directly from the company, and I always buy the most updated platform. Now, a lot of medispas will either rent or lease, or sometimes they will buy a device, and microneedling devices are a lot cheaper than high performing lasers are. So their overhead is a lot less, and they don't have to pay for like a Fraxel tip or a thermage tip or replace the pulse dye in a pulse dye laser. What I'm saying is microneedling also is more readily available and more abundant, because not only is it easier to do, easier to find people to operate the device, but the overhead is so low. It's a cheap device, and it's a pretty cheap product. So they make a lot of money when they up the price for a package or a treatment, and they have very low cost of overhead. So that's also something that is in the behind the scenes in aesthetics that you have to think about. I mean, a pico laser, which fires at a trillionth of a second and is a very elegantly, very high performing laser, that is a lot more expensive than a microneedling device that's going to poke holes in your skin. And that's also why they call, microneedling a cheap alternative to lasers. Lasers use collimated light to basically have zones and columns of treatment zones in the skin, whether it's ablative and it takes out the tissue, or it's non-ablative and it just heats up the tissue and disperses heat to stimulate collagen and have all the rejuvenating effects that a laser has. Microneedling is like, well, if laser pokes holes in the skin, we could just do it by poking holes in the skin and having the same effect. It doesn't work that way. Physiology doesn't work that way. The mechanism of action just doesn't work that way. There's people who think like, well, lasers poke holes in the skin, so let's just poke holes in the skin with microneedling. There's so much more that goes into a laser, and the theory of selective photothermolysis and the dissipation of heat and the stimulation of fibroblasts. It's not just like taking a pin and just poking a bunch of holes in your skin. It just doesn't work that way. It's oversimplified, and the results are mid and underwhelming. Now, I'm sure I'm going to have people in the comment section saying, I had microneedling and it was great. A, they're probably younger, or B, they probably work in a medispa that promotes microneedling. And just keep in mind, you guys, one of the biggest microneedling companies on the market has over $3 million a year dedicated just to marketing alone. And they have some pretty big celebrities and influencers backing it up. But I highly doubt these influencers or celebrities are even having these actual treatments, because I'm pretty well connected in the Los Angeles area, and I know firsthand that they're not, because I know the actual plastic surgeons and dermatologists that they go to, and they have treatments other than microneedling. So just keep that in mind. I hate to spill the tea on the bad and ugly things going on in aesthetics, but also my heart is to protect you and to offset all of the ridiculous craziness that's going on in the field of aesthetics with unlicensed providers, everybody opening medispas, nobody knowing what they're doing, and people making a bunch of money and hurting people and hurting patients and hurting my patients and hurting my beauties. If anything, I just want to be the source of truth and reason in an industry that has gotten so out of control and so chaotic, but we're going to hone it back in. We're going to keep it honest, we're going to keep it science-based, we're going to keep it non-sponsored, and I'm here to protect you, and I love you, and I'm about to go to clinic and see you guys and do all the things that I love to do. Also, you guys, you have to remember, I've been doing this a long time. I've been doing this for 20 years, and things that seem new, like the fact that microneedling is getting so much hype now and so many people are using it, it's just, I've been using this since 2013 or 14. The hardest part for me is that because aesthetics is being so overtaken by people who are unlicensed and just trying to make a bunch of money, it's cheapened the whole experience. It's cheapened the whole subspecialty. And when I say cheapened, I mean quality of outcomes the patients are getting for the amount of money that they're spending has really gone down. You should expect great things when you have a procedure in an office or in a medispa. And buying a package for a session of microneedling can be very expensive, and patients are often disappointed. Being a provider who is usually on the receiving end of things gone wrong and complications occurring, I see about 20 to 25 patients a day, depending on what procedures I have scheduled that day. A handful of them are people who have complications from microneedling, because in Orange County there's like medispas, they're like a dime a dozen and they're everywhere. And people often have complications from microneedling, whether it's hyperpigmentation, atrophic scarring, increased in skin laxity, opening up of the pores, worsening of pore size, worsening in their texture. I feel really bad for patients coming in to see me and having to spend money to reverse these complications when they should have saved their money and saved their skin and avoided these complications. I've had people come in with infections. I would say hyperpigmentation is the main complication that I see more of than anything, followed by increase in skin laxity, more visible pores, stretching out of the pore size, less likely the atrophic scarring. But when that happens, it's like horrible. And it's especially horrible because it's happening to people who paid a lot of money to make their skin better, and now their skin's worse. So because I'm on the receiving end of these complications, also I'm just not a fan of it. Not a fan of microneedling for that reason. I've been in aesthetics for a long time. I'm 46 now, and I've been firing lasers since I was probably 21, 22 years old, working in a laser research lab. So I have an inherent passion for this and desire to understand these devices and how they work. When I see bad things happening to good people, and I see right through this industry, and I see a lot of hype and marketing and billions of dollars going into something like microneedling and seeing horrific complications from it, it's hard for me to say anything positive about it. But I also don't like being negative either. So this video is really hard for me to do, actually. And I want to explain something. What does atrophic scarring mean? Atrophic means like bound down, or like being pulled, or thinning or tightening. Atrophic scarring is like if you ever get an acne lesion injected with steroid, the acne goes away, but then you can get like a little divot because you have wound contraction, and you get almost like a little depression or like bound down thinning of the skin. That's what can happen with microneedling. And what I've seen before is people who have beautiful smooth skin and wanting to do something proactive to stimulate collagen, and they have microneedling. What happens is there's like the prongs of the microneedling are penetrating into the skin, and there's an arc of radio frequency that goes between the two pins. So it's going between these two pins. That arc of radio frequency sometimes can be too superficial in the epidermis and cause like a contraction, which causes like a little dell or a little divot in the skin. And so you have repeating divots in the skin, and you almost have these little like poxmark scars. So now you look like you have acne scarring, where before you had smooth, beautiful skin, and you were just being proactive and trying to keep your skin looking beautiful and rejuvenation and stimulating collagen, and now you have these pockmark scars on your skin. I see it way too many times in my Newport Beach office, and it's just devastating. So this is my PSA. If one person watches this video and can save themselves from that complication, then my job is done and I'm happy. This is my favorite health food store, and I always get my smoothie after working out with my trainer. So I get my smoothie. Ooh, and that's for me and Steph, my amazing laser nurse. When shopping around for finding an aesthetic provider or an aesthetic treatment, try to go from the vantage point of the person offering you a treatment. So if somebody's recommending microneedling, do they even have a laser, or do they have anything more elegant or more substantial, or are they only offering microneedling or a dermapen because that's all they know how to do, or that's all they have access to? So always question the vantage point of your provider. It's really important to, educate yourself and just try to look at the whole picture and say, why is this medispa pushing microneedling so much on me? A lot of my patients will say, well, my esthetician recommends microneedling, but you have to think an esthetician in most states isn't qualified or allowed to do laser. They're not licensed to do laser. So of course they're going to recommend microneedling over a laser because that's all that's in their scope of practice. But that doesn't mean that it's the best treatment for you or your skin. Something else that I wanted to bring up is microneedling with PRP. So PRP is just platelet-rich plasma, which is basically a blood product. You go into an office, you take a blood sample, they spin it down, and they reconstitute it or mix it with some other biostimulatory component sometimes, and then they apply it to your skin after microneedling. So there was recently a report of patients contracting infectious diseases, including HIV, from blood products that were being used on other patients. It's such a crazy world out there, you guys, and you may not see it, but as a cosmetic dermatologist and expert, I'm like on these panels and roundtables and advisory boards, and I see the complications that are occurring in this country in aesthetics. Microneedling using PRP from other patients who are infected with infectious diseases is a real thing, and it's happening. So you just have to be really, really careful where you go. But on the topic of PRP, PRP has a lot of benefits with regarding inflammatory conditions like alopecia, hair loss, things like that. There is no doubt PRP is very helpful in hair regrowth, hair restoration, also for musculoskeletal issues. So, athletes who use PRP injections for joints and joints musculoskeletal injury, there's an anti-inflammatory component of PRP that's really, really helpful. But when it comes to anti-aging, there is zero data showing that PRP or PRF with or without microneedling is advantageous or effective. So just keep that in mind too. Don't let the marketing fool you guys. Stick to science always. So there's also a new revolutionary new technology called microcoring, which people often confuse with microneedling. Microcoring, also known as EllaCore, is a microcoring procedure where we take little columns or cores of skin out to essentially shrink wrap the skin. And any one treatment, depending on the settings, you can take out 8 to maybe even 10% of the skin in one session. And what happens is you basically shrink wrap the skin. So it's really great for people who have a little bit of like lower face laxity and thin skin, and it's FDA approved for the treatment of moderate to severe rhytids or wrinkles in the lower face. But unlike microneedling, where needles are just poking the skin, microcoring is actually taking micro cores of skin out to help shrink wrap the skin, and that is true skin tightening. We've been having amazing results with EllaCore. I just got home from running my kids around and from work, and wanted to continue one thought that I was talking about in my office before my mic went out, and that was EllaCore and microcoring and how that's different than microneedling. So microcoring is like microneedling in the fact that needles are used to poke holes in the skin, but instead of just poking holes in the skin, it actually is doing thousands, usually 8 to 10,000 miniature core punch biopsies out of the skin. So you're removing skin. You can remove about 10% of the skin, which helps skin tightening and shrinking the skin. And there is no dissipation of heat, there's no energy, there are no photons like a laser. It's just basically microcoring and a mechanical removal of 8 to 10, sometimes 12,000 little microcores of skin. So microneedling is just poking holes in the skin. Microcoring is microcoring out skin excisions, if you will, to tighten the skin. So I hope that distinguishes the difference. I just got out of the shower. Haven't put anything on my skin yet, but this is Neck Tight Serum, a product that I formulated. It took me over 2 years to formulate to get it perfect, and it's made for the neck and décolleté. I get melasma on my neck a lot, and I get my spray tan always comes off on my neck. It gets all patchy because I like to get spray tan, and I always bring my products down to my neck. But Neck Tight is a formulation that I developed for the neck and décolleté. And on the topic of microneedling, if you do use a dermal roller or dermal pen, you can increase penetration of active ingredients. Vitamin C, the vitamin C of K that I formulated is stable and increased vehicle delivery systems, because vitamin C is a very finicky and very pH labile and pH sensitive active ingredient. It's one of the best active ingredients for the skin. You can see my skin gets red as I rub my products in. But vitamin C of K, RxR retinol, Neck Tight, the amount of money that you would spend on microneedling, a microneedling package is a lot more expensive than using some of these products. And honestly, using these products within like a matter of days, you'll notice a change in your skin because of the vehicle delivery systems, the active ingredients. And this is why I formulated my own skincare line. It's just me and a personal chemist who I hand selected, who is an absolute genius. And we formulated these skincare products. People who use these products don't even need microneedling or a lot of in-office procedures because of the way that they have been engineered. and all that they can do. I'm using my NMF hydrator. This is stacked full of anti-aging polypeptides and ceramides and natural moisturization factors to help restore the barrier. If you do have microneedling, the NMF hydrator will help your recovery, but instead of doing microneedling, and it doesn't have to be my line, but just get a good vitamin C and get a good retinol and you'll be good. Your skin will be changing and showing results and turning over and increasing cellular renewal. So after my vitamin CFK, my NMF hydrator, this is the RXR retinol. It's called RXR retinol because it binds the RXR receptor, which is a retinoic acid receptor in the skin that unblocks a bunch of signal transduction cascades in the skin to help stimulate collagen synthesis, elastin synthesis, increase cellular renewal, increase barrier repair, minimization of the transepidermal water loss to hydrate the skin from within. These skincare products are next level because I spent 20 years of my life going to school just knowing exactly what the skin eats and exactly what vehicle delivery systems are needed to get there to get real life results within a matter of days. These guys are my babies. So if you don't want to invest in microneedling and you want to save money and actually have real life results, just invest in good skincare. And honestly, it doesn't have to be my line, any medical grade skincare line. And the way you know if a product works is once you start it, if you notice results within a couple days or even weeks, then it's working. If your friends are like, hey, did you get a good night's sleep or did you just get back from vacation or why is your skin so glowy? That's how you know when your products are working. They will tell you and you'll notice results within days. Thank you guys for watching and be sure to subscribe to my channel so that you get notifications for next week's video, because in next week's video, I'm going to be covering a highly requested topic that you've all asked me to do. Are at-home devices and LED masks worth it? And we're going to get into the science of these devices, and I'm going to teach you everything you need to know so that you can make an informed decision whether you want to use one of these on your skin or actually purchase one. So we'll cover everything from the science of these devices, ones that can actually do more harm than good for the skin, and are they actually worth the money. So we'll see you next week, you guys. I love you.